Hi, I'm Sung from Christmas Island. I'm going to talk about combined chronic disease care plan. I believe I'm not a bad clinician, but when it comes to public speech, I'm sucks. And as you can hear, I got a Korean English accent. So I try my best. Okay, here you go. So I'm from Christmas Island, right there, if you can see it. Yeah, it's very far, but this is not a main topic, so if I have a chance, I might come back, okay? They're my staff, well, our crew. Okay, so what is combined chronic disease care plan? Let me ask you first question. True, false question, very easy. Many people have more than one chronic disease or condition at the same time. True, false? True, that's right. About 50%, 11 million Australians has more than one chronic conditions. Second one, many chronic diseases share common risk factors that are preventable. True or false? True. So according to research, the most common chronic disease seen by GPs are hypertension, diabetic, depression, arthritis, lipids. So this is from 2016 WHO. You can see 3 major chronic diseases share exactly the same risk factors. And this is pretty much the same thing. Again, chronic disease share, yeah, you can see it. But they share most of smoking, diet, and then inactivity. If you want some numbers, 60% of a diabetic patient and 50% of a cancer patient, and again about 50% of a COPD patient will have cardiovascular disease, so on. So another question. This is a real patient from Christmas Island, 48 years old, male, smoker, type 2 diabetic, and kidney stage 2, 16% of a cardiovascular risk, which is high. He has gout. So who is confident in this room can say today, what sort of clinical items we have to do it? And what sort of pathology, and how often? And what about referral? Does he need to see any physician, dietitian, podiatrist? And how often? And what sort of guideline we have to follow? So good to have a Heart Foundation here. So the National Vascular Disease Prevention Alliance been working since 2000. But they do have their own guidelines and policies and recommendations. And they do have, like a previous session, we had a beautiful calculator. However, actually, I had a chat with the Diabetic Australia yesterday. I asked, what if someone has a diabetic and also have a kidney disease? Do you have any recommendation in guideline? No, they don't. Same to any other organization. And our GP loves to use red books. I don't really like it. And I have a remote area nursing background. I love to use CAPA. So, this patient, 2 options. First, individual recall for each condition. Previously, before my time, Christmas Island, this patient had multiple recalls. So 3 months diabetic checks, yearly diabetic review, kidney disease blood every 6 months, and kidney disease review every year. He might have a physician review, he might have a diabetic educator review, and he might have some sort of gout review, so on. So we are sending letters after letter, phone calls after phone call, and patients start ignoring health service. So a lot of time consuming, and many letters and duplications. And as you know, chronic kidney disease and diabetic, they share quite a number of pathologies as well, and checks. We don't want that. So that was first job when I started with the Christmas Island last year. So I wanted to make some sort of a combined care, which is holistic, and which we are not wasting our time. We have more time with the patient instead of duplicating all the checks and blood tests. So Dr. Paul, anyone from Northern Territory? No? Dr. Paul is public health physician, work for anti-health. He developed the primary care plan based on cardiovascular risk and CKD stage and whether they are diabetic or not, which is like this. Anyone seen it? No? So basically it's the color coded. Green, healthy person. Yellow has got a bit of a high, well, cardiovascular is low and moderate, and also kidney disease. And if you look down, can you see the mouse pointer? Yeah. All the numbers represent how often, every 12 months or every 6 months. Can you see it, the numbers? Not really? No. It's not user-friendly. If you do have a computer program called PCIS, or Communicate in Northern Territory, fantastic. They have a built-in system. You just choose cardiovascular is high, patient is diabetic, bang, care plan will come up to you every 6 months or every 3 months. It will prompt you what to check and what sort of pathology we have to do it. So I developed this, user-friendly, I believe. So I'll quickly show you. So I simply used Excel spreadsheets. So I'm going to make this patient really healthy. Oh, what happened? Sorry. I'll test this one. Oh, what happened? Could I get technical? Sorry. Okay. Normally, if I click, can you see that cardiovascular risk? If I click this one, normally the arrow will come up, that one little one. I don't know why it doesn't come up. It's a bit glitching. So cardiovascular is low, kidney stage is 0, so doesn't have kidney disease, and he's not diabetic. So can you see the numbers changing? So this patient needs every 24 months clinical items, that one. So basically consent, cardiovascular risk assessment, blood pressure, oral health check, something like that, so on. And pathology items, so basically full set of blood. We start doing checking health check from 45, and also this patient needs a GP review and also medication review if they're on any medications. So now I'm going to change the cardiovascular risk. Let's make this patient really sick. High. And his kidney disease stage 3. Can you start changing numbers? And let's make this patient diabetic.
So are you selling this?
Yeah. I will share, I'll give you for free. So you can see that this patient needed this pathology. That color of this one is a blood tube, purple top, gold top. And then you can basically, well, some place nurse will write it up pathology form, but some places not, I think. So you can prompt GP. Not every GP is confident dealing with a chronic disease, I believe. So that's what we do. Normally, nurse will print out form, and then GP can, of course, it depends on individual patient. You can add more tests, or you can delete. Like if HbA1c is stable, over 70, you don't want to do it every 3 months, right? And this is kind of a guideline. But like a TSH, you have never done, then you can prompt GP, well, we haven't done any TSH. And then this patient cardiovascular risk is high. Shall you do it or not? So this is again guideline. It's not absolutely you have to do this, and again depends on patient and depends on their compliance. So I do have only 4 chronic recalls for each chronic disease patients. So there is a bit of a system. I again we did this one conjunction with this. So if I have a chance, well, you can grab me during lunchtime. I can tell you more what actually we're doing at Christmas Island. And anyone using medical director? A lot? Yeah, some medical director, you have to put clinical items, put it in. However, it all the time comes to progress note. At the progress note, you have to put something like an oral health check. And everybody's format is quite different. So if you go down here, few tabs. So this one for adult health check. I like a drop-down menu. So then you can choose one of them. And if there's a abnormal, it goes red. And then action, well, you can write it down. Free texting is fine. And then what you've done, and then you just select them and copy it to your MD note. Or you can print out, scan it to your note. And there is direct note as well. So food checks. Everybody's food checks is different. So they say some nurses say, well, food is fine, no ulcer. But you really have to go step by step. And this will prompt you and remind you what to do. So again, all the drop-down menu. And then if you want to know, if you put your mouse, then that will explain to you what is ulcer, what you have to look at it. And again, same thing, once you fill it up and copy and paste your note. And asthma review, and similar. Basically, I do use this one for anyone who has asthma. So, so basically, you get consent, and then whether you're taking any medication, and that one. If they want any medication, I put all Australian, well, medication you can possibly find in Australia. So if you know the dose, it's good. If you don't, just select one of them, and that one will tell you what sort of medication they're on. Whether there's LABA, SABA, or corticosteroid. So you don't want a patient have LABA. So they gotta have some sort of SABA as well. So again, you don't have to know the medication, how it works, but actually if you know, you can prompt GP, look, this patient has only LABA and LABA. I think patient needs something else. Okay, so go back to PowerPoint. About 3 minutes. Yeah. And I developed a paper format as well. Again, it works with the MD. So left-hand side, you have to put all the data to MD. Right side is all progress note, which in the Excel spreadsheet, copy and paste your MD note. And that is simple Fritz magnet as a reminder. I try to reduce a lot of letters. And I have to put this on for my manager. They've been working hard to basically it's a hospital, but then we try to implant the primary health. And also we didn't have a practice nurse because we are a hospital. But then we made a practice nurse role, and then a nurse has a chronic disease care portfolio, which is me. The outcome was both a lot of satisfaction from nurses, doctors, and also our clients. Because reducing time, previously, whoever comes in for health check, chronic disease, I'm not kidding, takes 3 hours. And for nurses, taking all the notes, writing them, and for patient about 2 hours. And that was ridiculous. And the patient doesn't want to come in because everybody's working at Christmas Island. And then with this system, the clinician very confident, and actually our practice nurses are ENs, so they didn't know what to do, and then they were so overwhelmed with the chronic disease checks, they didn't know what to do. So I do education as well. So they're very happy, and this is within 4 months, we completed 63% of chronic disease checks. So future. So at the moment, we're spending 70 to 80% of our health budget on chronic disease. And in that, 97% for management and treatment, and only 3% for prevention. Thank you.